struggling with pain in your foot. Maybe it aches in the heel or in the toes, or when you wake up you can't put weight on it when you're getting out of bed, or maybe just during the day they start to ache and have tension and pain, and you're looking for a simple way to release this, then this video is for you. Welcome to week 1 of the summer reset. Over the next 7 weeks, I'm going to share with you different positions that you can do using block therapies, wooden block or a tightly rolled up towel to start off with, to release all the tension, aches and pains that you have throughout the whole of your body. So all you need is a tightly rolled up towel, and I'll show you in a moment how to roll that up. So hello, my name is Catherine. I'm a block therapy instructor and fascia alignment coach, and I use block therapies practices to support myself when there's ever any aches or pains or tension throughout my body. And I also support people through classes and one-to-one support so that they can start moving with ease and get rid of those tensions, those pains and those aches as well. So let's get started. So first of all you need to do is get a medium-sized towel, fold it in half, and then fold it in half again, and then one more time, and then you want to tightly roll it up. So just tightly roll it up as small as you can, and you can always loosen it afterwards if you need to. And then you'll have a tightly rolled up towel, maybe not covered in grass like I've got mine, and we can use this for all of the positions. You can loosen it slightly if it is too tense for you in the positions, or you can place a bobble or elastic band around the towel so that it doesn't loosen up at all, and your breath is always your guide. That's the only rule that you really need to pay attention to, is the breath. If you can breathe in a relaxed way throughout these positions, then you're helping to heal the body. If you can't breathe in a relaxed way and you hold your breath or it takes your breath away, you just need to back off, go to a position that you could breathe in a relaxed way, or to come out of position, try it an alternative way, loosen the towel, try it on a bed. So I'm going to be showing you all these positions on a mat, but you can do these positions on a bed, and some of them you can also do on a chair, which I'll show you as well. So let's get started. So this week we're going to be focusing on the feet. Now the feet are the foundation to the body. So when we are not standing correctly, we may shift our weight to one side, we may pigeon toe our feet in, or we may turn them outwards. We may just not have our legs in alignment, so we may be locking, hyperextending our knees out, so there's a lock in them, and this tilts the pelvis forward, and we may be putting more weight on the toes rather than the heels. So we should have 60% of our weight in our heels, and the majority of people have 80% of the weight in the toes. So we want to move our center of gravity back into our heels, and this takes a lot of time, a lot of awareness, but what can happen is the feet can then start to get pain in them. So this class is to show you what you can do to start releasing those feet. Now you might be thinking, I don't have pain in my feet, but this class is still useful for you, because even though you might not have the pain, are you able to move all your toes? Do you have the space that you need in between the toes? As these are the foundation, most people have been putting their feet into shoes that are shoe shaped rather than foot shaped, and this has caused the feet to get closer together. There isn't that natural spread. We can't individually move the toes. If you look at a baby or a toddler's foot, when they're moving, they have so much space, they can move each and every toe, and that's what we want to be able to do. So this class will help you to release that tension in the feet. But we always start in the belly position, and we do this to connect to the breath. If we don't use the breath when we're in positions, we're just not utilizing that internal pump, and we want to be breathing diaphragmatically. So most of us have started to breathe through the chest using those upper muscles, and there can be a lot of strain there, but also we're not getting all the breath that we need. So if we're breathing just from the chest muscles, we get 6 times less oxygen in the body. So you want to be breathing from the diaphragm. So as we breathe in, and we'll do it for a count of 4, we expand that belly outwards. We can then bring the breath up to the chest, but we want the breath to start in the stomach. And then we exhale for a count of 6. Imagine that belly button's going to the back of the spine. And we want to make sure that we're squeezing that small, like wringing out a sponge. And then you take your next inhalation. And that's how we'll breathe all the time that we're on the towel or the block. So we use in block therapy the wooden block, similar size to the towel, but for all these classes I'm going to use the rolled up towel, and obviously if you do want to get a block, there's a link in my description to show you how to purchase a block therapy block. So let's come down to the mat, and as you can do this on the bed, and also if you want to do it on a chair, just sit on a chair, find your belly button area, place your hands on, and then just start leaning forward, connecting to that diaphragmatic breath, and just following along the same but sitting in a chair. So if you're doing it on the bed, you can also lie on your back. So rather than lying on your stomach, which we're going to do, you can lie on your back and add pressure that way as well. So slowly come down to the mat or the bed, find roughly that belly button position, and then stay up on your elbows. We don't want to be hunched, so if you can't just support yourself on your elbows, do get some cushions or support pillows, or if it feels comfortable for you, you can come all the way down and lower the body down. And now we want to start connecting to that diaphragmatic breath. So breathing in for a count of 4, feeling that belly expand. So you're like lifting your belly up on the towel, and then exhaling for a count of 6. You'll feel that belly going smaller, feel yourself sinking into the towel. And then take the next breath and just keep doing that, really concentrate on that breath. And we want to stay in this position for a minimum of 3 minutes if you can. We want to make the exhalation the focus of the breath, because we want to be exhaling all that waste out of the body. So you may feel pressure, a pulse, which is the aorta, you may feel pain, and the pressure and pain can be due to inflammation, undigested food, or waste that hasn't been eliminated. And all this is normal as long as you can breathe in that relaxed way. And when you've done your 3 minutes, you just place your hand underneath your shoulders and slowly exhale up and out of position. So the next position we're going to do is the Achilles. Now this is at the bottom of the foot. So I'm just going to show you how to get into position. So you can do this by going on your knees, placing the towels, you might want to roll it tightly up again, and then coming back and sitting on the back of the foot. You want the foot to be straight, and want to add the pressure there. You can lean forward to take some of the pressure off. If you're not able to be on your knees, you can simply lie down or sit up, placing that towel underneath, and then you can add pressure this way as well. So whichever position you decide to do, we want to stay in that position for that minimum of 3 minutes, and you want to be searching for pain. So we become pain seekers. We want to search out the pain so we can breathe it out of the body. And just make those small movements. You can turn to the left and turn to the right. Focusing again on that full exhalation. Breathing in and out through the nose if you can, in for a count of 4, feeling that belly expand, and out for a count of 6, feeling that belly going small. And then once you've done this for 3 minutes, you would exhale up, maybe tightly roll up the towel again, and then you would do the other side, so placing it underneath, or if you are with your legs out front, just change it to the other foot. Check in with this one that the foot is straight, and then again stay in this position for a minimum of 3 minutes, moving to the left slowly and moving to the right. And then once you've finished, just exhale up. The next position we want to do is the top of the foot. So you can do this in a chair, and you can just lean and add pressure. You can also put the other foot on top and add pressure as well. If you want to do this on your knees, you would just come down, placing the towel underneath the foot, and then you can add pressure and lean back. You can also add the other foot for extra pressure, and that also gets into sort of just underneath the bum, into the thigh, and adds a nice decompression there as well. So you've got the weight onto the foot, you're also doing the Achilles again and getting that pressure in, or you can just do one foot, lean back and add that pressure onto the toes. There's 26 bones in the feet, and we want to make sure that they're in alignment. When our feet are not facing forward, or maybe we've started to rotate them outwards or inwards, or maybe those ankles are falling in or out, the fascia can get locked and twist and hold us in incorrect alignment. So we're trying to release everything so that that blood and oxygen can flow all the way down to our feet. So just moving to the left, feeling any tension, connecting to that breath, and then slowly moving to the right, again feeling that tension, exhaling it out of the body. And then once you've done that side, you can exhale up and then do it underneath, or again if you're sitting down on a chair, you would just place the towel on top. You can place your foot on top, and as you sat down you can add the pressure like that into the foot, so the foot will be flat on the ground and you'll be sat on like that. And once you've done both sides, you can exhale up, and for the next position we'll be doing the bottom of the foot. So again, tightly roll up that towel. You can do this standing sitting on a chair, and then putting your foot on the middle of the towel. Get a work surface next to you if you want to stand up completely, lean onto something, or just add pressure with pushing down onto the knee. We want to stay in this position for that minimum of 3 minutes again. Breathing in and out through the nose, and just searching to the left and to the right, finding where that pain is for you and breathing it out of the body. If you're standing onto a surface or a wall, you can add your other foot onto it, and then that can add more pressure. And once you've done one foot, you can do the other foot as well. And the final position I'm going to show you today with the feet is using your hands. Now this does take a little bit more time, but again you can do this sitting on a seat, on the sofa, in bed, and we want to get right in between each toe. So spread those toes as much as you can and get a finger, any finger. I use the index finger. You can also use a pencil or a wooden dowel, and really pull into that webbing in between the feet. And you want to feel some pain, feel that tension. Connect to that breath again, in for a count of 4, out for a count of 6, and you'll start to feel some pain. You can flex the toes, you can pull them, you can even use a piece of rope if that is easier for you. Whatever you need to do to get down to those feet, to get in between the webbing, so that these feet can start to spread. And if you can do in between each for 3 minutes, that would be ideal, but if not, even a minute in between each one, and then you move to the next one and do that minute or 3 minutes, and then the next ones, and then the next one. And then if you do have a bunion, you can also press, or even if you don't, but you can also press right on it, just to have some pressure in that thumb joint, that big toe joint right there, as you're adding some pressure. And then once you've done both feet, you want to cement that new grip. So standing up, feet facing forward, slight bend in the knees, holding your body up so that you're about hip distance apart, and you want to grip, spread the toes and grip them, and take 5 breaths in this grip, and then walk around and feel how your feet are feeling. So notice now how your feet are feeling and how you're feeling inside. When we connect to that diaphragmatic breath, we access that parasympathetic state where the body can rest, digest and heal. We take ourselves away from that fight or flight and we come back into ourselves. So just notice how you're feeling. Notice the sensations in your feet. Do you feel more warmth, some tingling sensation? So thank you for joining me today, and next week we will be doing legs, focusing on the legs. In the meantime, I have other videos you can watch on YouTube, or if you do want to join an online class, there's a link in my description as well. I also have in-person classes and one-to-one support. So thanks so much, and I look forward to seeing you next week.